Hi, everybody. My name is Jana French. I use she and they pronouns. I'm the Community Partnerships Director at Crisis Text Line, joining today from Brooklyn, New York. So while I get my slides up, would love to hear from you all in the chat about where you are joining from.
And just a quick announcement, there will also be a poll, a survey separate from the CE survey that you'll need to take too, and that'll be presented before the CE survey as well. Thank you.
Awesome. McAllister, Minnesota. I'll be in Minnesota next weekend. New Mexico, I just came from New Mexico. It was beautiful. Really enjoyed my time there. Oklahoma, Alaska, that is on my bucket list. Michigan, I was also recently in Michigan. More New York City folks, very happy to see that. So it's so great to be here with you all today. Like Dr. Endehorn mentioned, I'm going to be talking about back to school stress and some of the mental health playbooks that we have that can be helpful for having conversations with students. Even though we're like a little past the back to school time, it's always really helpful to talk about school stress all throughout the semester. So a little bit about me. I've been with Crisis Text Line for 6.5 years. I really focus on our work with nonprofits, local, state, federal government agencies, and education systems, but also really helping communities understand what Crisis Text Line is and how to really share it with people in a way that's empathetic and caring, and what kinds of things we help people out with. I often hear from people when they think about Crisis Text Line, they think about emergencies or they only think about suicide, and those are definitely cases that people reach out to us about, but they also reach out to us to things about things like stress, anxiety, grief, all of these sort of human emotions that we're all going to experience at some point in time in our lives because that's what it is. That's the way that the world works. So that's a bit about me and my work. This is the disclosure and disclaimer statement. If you want to take a look at that at your own time. And then some of the objectives for today. So by the end of this presentation, I'm hoping that you all will be able to identify some common school-related stressors impacting students at various education levels. So we're going to be talking about elementary school all the way to college. How to or examining age-appropriate mental health strategies that we have laid out in this playbooks that we'll be sharing, and then be able to effectively convey the concept of mental health playbooks and foster a supportive environment for young people to engage with. And a couple of notes. My presentation kind of has three natural stopping points for questions. So I will be happy to see them in the chat or in the Q&A box, or at that time, if you want to raise your hand as well and ask questions, let me know. Okay, so we'll be talking about, like I said, the three natural points in which there will be a good place to stop to ask questions. So we'll be talking about what is Crisis Text Line, just to give you all a background of what we do and how we partner with Native communities. We'll be talking about back to school stress, how to identify when students need help and what to do, and then our playbooks. So we'll start with a bit about Crisis Text Line and our partnership with Northwest Portland Area Indian Health Board and IHS. So Crisis Text Line, we are a national nonprofit. We provide free 24/7 mental health and crisis support via text in English and Spanish, on text to 741-741, on WhatsApp for two different numbers. One is English and one is Spanish. And then we also have web chat as well. We launched in 2013, and since then we've trained 80,000 volunteers to engage in actually more than 11 million conversations with people in crisis. In 2024 alone, that looked like 1.33 million conversations. About 2/3 of our texters are younger than 25, so really in that at school age demographic, which is why we really focus on that in our work. And interestingly enough, our volunteers are also around between the ages of 18 and 25. So we're most often connecting young people with young people to help them through these rough moments. We're also a member of the 988 Suicide and Crisis Lifeline Network. So we take national text and chat backup. We're in about 20 centers, and then we take Spanish text and chat backup as we're one of 3 centers that does that. And so what you'll want to do whenever you're sharing Crisis Text Line with folks in your community is remind them to text Native or Indigenous, both of those work, to reach out to us for support. And here's a bit about what's going to happen when somebody does reach out to us. So, like I mentioned, we have texters who reach out. They can be anyone of any age. We have people younger than 13, older than 65 that reach out, and they can talk about anything that's going on: eating disorders, relationships, breakups, divorces, work stress, anything that you can think of. Um, they will, when they text in, they'll start by getting a few automated messages back that will let them know that they've successfully connected. It'll share a link to our terms of service, and then we're going to ask them, what's your crisis? That next message really tells a little bit more about what's going on, is run through a machine learning algorithm that we built that helps us triage our texter queue. So it's learned the words that people use when they're at most imminent risk. And if somebody is using one of those words, they're going to go right to the top of our line so we can reach those folks the fastest. From there, they'll be connected with one of our volunteer crisis counselors. Like I mentioned, these are people who are 18 and older. They've completed our online self-paced 15-hour training and a background check. And the training really covers things like active listening, empathy, collaborative problem solving, and risk assessment, all the different kinds of techniques and skills that people will need to have these conversations, but are also really helpful in day-to-day lives. I know that I have gone through crisis counselor training, and it was really helpful for me in talking with my family, talking with my spouse, talking with the children in my life that I help take care of. So it really is an all-around good training. Those volunteers are going to be logged in from home, and we just sort of connect texters with whoever is the next one available. So we're not routing by any location at all. And the volunteer is really going to start by building some rapport with the texter, really trying to figure out what's going on. And we're going to do a risk assessment in every single one of our conversations. We know that even if people are reaching out to us about school stress and they haven't mentioned anything that kind of seems like it might be about suicide, that they still might be thinking about it. And if that's the case, we definitely want to help that person out. I should also mention that on all of our conversations, we have two pairs of eyes. We have the volunteer, and then we also have our supervisor. So these are our clinical staff that can see every conversation as it's happening to provide real-time feedback and additional support. And then in the case of somebody who might need more of a safety plan or potentially is at imminent risk, the supervisor is going to take a much more active role in that conversation. So like I mentioned, the volunteer is going to start by building some rapport. We're going to do that risk assessment. We see that about 2 to 3% of our conversations are with people who are at imminent risk for suicide, and then we're able to de-escalate those folks most of the time. In less than 1% of conversations where there is a life-threatening imminent risk situation, we will contact emergency services to send help to that person. But like I mentioned, that's really a small percentage of the conversations that we do. About 97% of the time, people are not imminently thinking about suicide. And in those situations, what we're going to do is identify the goal, what this person really needs from working with us, do some collaborative problem solving to move them towards that goal, and then we wrap up the conversation on average after about 45 minutes. When the conversation is over, we send out two surveys. So one is to the volunteer who took the conversation. They're going to check off any and all topics that were listed, that were shared in the conversation, and then also kind of check in about how they're feeling and if they feel like they could take another conversation or not. And then we'll send a link to our volunteers where they can tell us, or to our texters, sorry, where they can tell us how they think we did, how they feel now that the conversation is over, and any demographic information that they're willing to share. And we see folks fill it out about 20% of the time. In about a third of our conversations, we share a resource with a texter. Sometimes when people think about resources, they think about places to go, or they think about the continuum of care. And those are some of the resources that we share. But a lot of the times, what we're sharing are things like exercises to do to help ground somebody in the moment, articles or self-help guides that they can use to get more information about what their situation is that they're experiencing. And then also online forums where they can connect with people who are experiencing similar issues. So we do have native resources specifically available for our texters, especially if they use that native or indigenous keyword when they reach out. That'll let the volunteer know when they take the conversation that this is a person who identifies as native or indigenous, and if we're going to share a resource, that it might be best to pull one from that list. For example, the IHS treatment locator, best place to send folks for finding care in their community. So we've worked with Northwest Portland Area Indian Health Board and IHS since 2020 on that text native or indigenous to 741-741. You've probably seen lots and lots of words out there: hello, home, share. We have so many words that you can use to start a conversation with Crisis Text Line. And the truth is that it doesn't matter what people reach out to us about, reach out to us with using that keyword. Um, you're always going to get help. You could like leave your phone unlocked in your pocket and send us a bunch of letters and numbers, and we will respond to that person. But using that keyword really helps us kind of understand how a community is using crisis text lines so that we can provide back some insights and help direct programming, understand who's maybe potentially more at risk based off of what we're seeing. So that's kind of what that keyword is there for. So when somebody texts Native or Indigenous, it goes right to crisis text line. They're going to have the same sort of experience as what I outlined just a minute ago, but the crisis counselor does see that this person is part of the Native or Indigenous communities, and that we have a tip sheet that we've developed with IHS and with Northwest Portland Area Indian Health Board to help guide crisis counselors in the best way to have those conversations, and also if resources need to be shared, that we have those resources available as well. And then we're able to provide back to these organizations a dashboard that shows high level anonymized and aggregated trends about how these lines are being used, as well as data related to all texters who identify as American Indian or Alaska Native in our post conversation demographic survey. So that really, like I said, it's very high level. So it's going to be things like 200 people reached out, and the biggest topic that they were dealing with was relationships. And then from there, we can say, all right, what are some of the things that we can do, maybe in social media or in the trainings that we do like these, to really address the topics that are coming up most often right now. Since we launched in 2020 with these keywords, we've had nearly 2,000 conversations through the partnership. Um, we also get some anonymous texter feedback that texters agree that we can share out with people. So this is one of those pieces of feedback. What the texter said was that I've never had such great care with any mental health officials. This conversation changed my entire day and made me feel very hopeful for my future. I'm so thankful to this whole team for being able to help out our Native community. I will definitely be contacting in the future for when I need help. And these sort of just help us know that we're making an impact for people. We don't like to share them in like marketing or anything, but in presentations like this, I always find it helpful to share what real people who've used the service have to say. All right, so that is my first natural break point for any questions about Crisis Text Line before we get into the back to school stress topic. So, if you have any questions, you feel free to put them in the chat. You can put them in the Q&A, or if you want to, Jonah, I don't know if the raise their hand works, but whatever is the best way. And I'll pause for like 30 seconds before I move on in case folks are thinking and typing.
Right, so you have the chat box, any questions or comments, then you also have the Q&A pod, and then, right, you are all muted at this time, so if you do have a question and would like to speak instead, go ahead and use the raise hand feature, and yeah, we'll go ahead and unmute you.
Mary, that's a great question. So crisis text line, we help anybody and everybody, but we work specifically with Northwest Portland Area Indian Health Board and IHS on those keywords to make sure that we're providing a culturally responsive response. So anybody can use it in your community, but if you use those keywords, that'll just let our volunteers know so they can reference the tip sheet and resources that we created. Danielle, great question. I always meant to talk about that, and I kind of forgot. So, like I mentioned, we are a part of the 98 Lifeline Network. That's been a huge part of my work over the last 5 years since it was signed into legislation. Um, we provide a slightly different service at 741-741. So we are going to connect people with whoever is the next person available. So we're not localizing in that way, or where we're routing to people who are available at local centers, because we're just sort of one center that has, you know, bonuses and minuses. So, one of the pluses on that is that if somebody is in a pretty small community and they know everybody who's working at 988, or maybe they're in a community that isn't accepting of a part of their identity or accepting of the kind of crisis that they're going through, it might help them to feel a little bit more comfortable to reach out knowing that they could be connected with somebody who's anywhere in the United States. The other biggest difference is that we use that triage algorithm to help us manage texters who are potentially at imminent risk and get with them faster. Whereas 988 uses sort of like a series of questions to help gauge how upset that person is. We do work with a couple of local organizations so that we can like be a little bit more localized, but we're always just connecting folks with the next available person. And then the last piece that's really different is because we're just one center and we're our own independent nonprofit, we're able to be a little bit more nimble with how we respond to what's going on, how we use the data from our services to inform the way that we train, inform the way that we staff, and then also we're able to share out some research and impact reports, which we do a few times a year on our website. Most notably, last year we put out a report about how young people would like to be supported by their communities based off of our conversations, to help guide lawmakers into what they can do to support young people in their communities. Um, yeah, so those are sort of the three main differences. Um, and thank you, Mary. Yeah, we do work with a lot of universities also to create something. Like I work with the City University of New York. They have text CUNY to 741 741. So we set up partnerships like this a lot, to help kind of get a little bit of a specific response from for a community. Okay, anything else, or should I go on to the next section? Okay. All right. So for what you all came here for, we're going to be talking a little bit about back to school stress. And we say back to school stress, but honestly, I mean school stress here because there's going to be various points in the academic year. There's midterms, there's finals, there's the back to school in the winter time after the holidays, that all sort of like creates this peak that we all are living around either as students, as people who care for students, as healthcare providers. So I think this information is relevant even though we are for many states. I know I grew up in Georgia. They've been back to school for over a month, but I think this is helpful information regardless. So, one thing that I want to start out with is that school-related stress conversations are more common topic of conversation for crisis text line than suicide. So that goes back to what I said earlier, where a lot of people think, okay, this has to be like a imminent risk situation, or somebody has to only be thinking about suicide, and that is not the case for a lot of our conversations. A lot of people are talking about school, something that like I just mentioned, comes up for pretty much all of us at some point in time in our lives. Um, and then when we think about what kind of topics are coming up alongside school, they also discuss relationships with peers and adults, feeling lonely. They do describe feeling suicidal, but then some of the other topics are, going to college or classes or jobs. What comes next after high school? Grief comes up, self-harm, money and homelessness, teachers and school counselors, bullying, therapy, a lot of these things that are a part of some people's schools experiences, and then also some ways that people also kind of cope with what they're experiencing, like talking with teachers and counselors. Um, when we think about school anxiety and stress, there's a distinct difference between when we're talking about texters who are under 18 and texters who are in sort of like the 18 to 24 college range. So for texters under 18, what's coming up more is bullying, relationships with friends, and then relationships with siblings, parents, and teachers. So, that's it can be very telling of what is happening. I mean, when you're in a sort of traditional high school or middle school setting, you're spending a lot of time with these same people. You're also all going through a lot of transitions, so there's lots to learn. You're sort of exploring new ways that relationships are growing. Maybe you're exploring romantic relationships. Maybe your parents aren't quite understanding what's going on, because that's like the age-old tale of time with parents and teenagers. And then with our slightly older texters, the 18 to 24-year-old texters, they're talking more about sort of those transitional parts of maybe, what's happening in their early adulthood. So financial stress, finding a job, feeling like a failure, and not knowing sort of what's coming next. Sexual abuse comes up. And then also, this is where we start to see more like specific mental health diagnoses. And this is all from a report that our research and impact team put together on our blog. So this link down here will take you to the full blog if you're curious about reading more. Like I mentioned, bullying comes up a lot in our conversations. That's a trend that over the last 6.5 years that I've been at Crisis Text Line, we slowly see rising. It had a small dip when COVID happened and when it was sort of at its height and we were not going to school. But unfortunately, it's come up more. We also see homesickness coming up. And then this topic about school refusal, which was new to me as somebody who does not have school-aged children or children at all. Um, and we wrote a whole topic page about this because it comes up more and more, and it's a child's intense fear or anxiety about attending school, which is beyond the typical like reluctance to go to school or occasionally like needing to skip classes, and it's more like refusing to attend school altogether. And this was really interesting for me, like reflecting on my own experience as somebody who has had anxiety my whole life, undiagnosed where until I was in college. I do remember like times when I would feel sick, even though I wasn't sick, and just feel like I needed to stay home from school that day. It was maybe once every few months. And when I think about that, that's more of the like homesickness, anxiety coming up, where school refusal is more so just flat out attending, like refusing to attend school altogether. And so this blog post that I linked here has some really great tips if that's something that a child in your life or a child that you're working with is experiencing. What also comes up is body image. No surprise, we're talking about a lot of people who are going through big changes in their bodies. And then bad grades, which is stressful for anybody to receive, especially if that's something that is coming up again and again for folks. And what we also like to share, though, is that school has a lot of positive aspects. So, this is a crucial place where students receive support from their friends, from the school themselves. And it can be a source of resilience because they are spending a lot of time with their friends. They're able to find some community there. Um, what we find is that in schools, what's they can really do to support students is provide them with opportunities for social connection, opportunities to engage in music, writing, visual performing arts, mental health services, and sports. This is kind of going into that community resilience report that we put out last year that I mentioned earlier. These resources that young people need, and mostly access through their schools. Um, so that's why school is also a huge positive part, and why sometimes we see people feel isolated over the summer when they're not in school. Um, so when we think about supporting students with school stress, we have a couple of tips, especially for you all as you're working with young people. So the most important thing is just to talk about it. Um, Especially with the sort of back to school season, but maybe even so now with like getting into the rhythm of the school year, ask them how students are feeling about being in school, the teachers that they have, about the friendships that they're building or how they're maintaining them, just generally what their fears are, what classes are they in that they're really excited about or that they're nervous about, and then just anything about this school year that presents them with a lot of opportunities. I think back to high school and just how every year sort of had these like monumental things going on. And so it's helpful to talk about them both in a sense of what are you planning towards and looking to overcome, and then also what are you excited about? When you work with students it's helpful to ask them really about what went well and what didn't go well to help them be able to reflect on what has happened so far and help them kind of identify maybe things that they want to work on or things that they want to do again. What are they looking forward to most in that next period of time before you see them the next time? And then just checking in about if they're feeling overwhelmed or depressed or isolated so that if they are, you might be able to provide them with some more support. It's always helpful to encourage students, even if they're feeling like sort of just a regular level of stress, to lean into their hobbies or try something new, and force the older adults, older children that you're working with, maybe folks who are in their later years in high school, offer them volunteer opportunities as well, to be able to give back. And then just always make sure that they have crisis text line available to them on lists of resources, have them save text native to 741 in their phones, in case they ever need it. Just some good things to remember as adults who, I'm sure all of us have been not 18 for a while. So helpful things to remember to do and not do. So do check in regularly to see how students are feeling and always listen with empathy and aim for understanding. That's something that we teach a lot in our volunteer training about how to actively listen and try to understand how somebody is feeling without pathologizing it or without sort of putting words in their mouth. Always reassure and validate feelings. It can be hard to hear somebody talk about something where you're like, well, I know now that I'm an adult that it doesn't matter that your high school boyfriend broke up with you because they're your high school boyfriend and you'll have lots of other boyfriends in your lives. But that can be a really hard and heavy thing in that moment for students. And so reassure and validate that that is tough, even if it seems trivial. Always look out for signs of more extreme stress, such as changes in behavior, trouble sleeping, inability to concentrate, or excessive school absences. And always make sure to follow up with a resource, especially, as adults, like young people might not trust us, but as long as they have somebody to talk to, that can be more helpful. When we think about what not to do, so don't force it, to have confrontation or conversations that can really make somebody kind of turn off from wanting to talk about what's going on, and also be sure not to lecture, which may be hard, especially as you all are health professionals. But being able to sort of share information in a way that is kind, and maybe take off the doctor hat and put on the um trusted adult hat as a to help kind of make that feel a little bit more natural. This is one that people always ask me a lot about relating by sharing your own story about a similar feeling or situation. In my experience, if you've gone through something extremely similar recently, that can be helpful sometimes to share, especially if that's the kind of rapport that you have with this student. But it's less helpful to be like, I remember when I was in high school and this happened to me, and look, I'm so much better now. Don't worry about it. That's not the right way to sort of share and relate. Especially young people these days, they really want to be heard and validated, and don't really like that relation part as much. It's also really important to remember that students aren't going to change their behavior overnight. And also to, especially this might be more relevant for parents in the room, like try not to get frustrated, angry, or show disappointment when they're going through a tough time, because that can be, it can sort of compound the negative emotions that they're having about themselves. Okay, so that's the next spot. That's a good area for me to stop to see if there are any questions or anything you all want to go over before we go into what the content is in the mental health playbooks. I probably have about like 10 more minutes of information to share, so also happy to keep going. It's up to you all, whatever um, you all want to discuss. Okay, I'm not seeing anything come up in the chat. So I'm gonna go on through, and then if you have any more questions about anything that I've talked through, like I said, this next section is my last part. There's about 10 minutes or so left of content, so I'm happy to talk about the whole presentation after we get through this section. So, all right, so we put together these back to school resources that are helpful all year round, despite the name. These are free downloadable playbooks for elementary, middle school, high school, and college age students. And they are broken up into those four so that we were able to make the resources in them age appropriate. Thinking about how an affirmation sheet looks very different for somebody who is 8 versus 18. But generally, the playbooks include affirmations, visualization activities, tips and tricks, wellness checklists, and guides on how to help friends. They are PDFs that I believe have already been put in the chat or they'll be put in a chat soon, so that you all can download and you can print the whole thing. You can print a part of it. You can take a part out if you have Adobe Pro and put it into something else that you're putting together for students and parents, however you need to use these resources. So our elementary school toolkit is going to have affirmations that look more like I'm loved and important. Um, I have a great family, things like those. When we talk about visualizations for elementary school students, it's more like things like what are writing down 3 things you like about yourself or 3 things you like to do. There are some coloring pages, and then there's these age appropriate back to school success tips like how to eat well, get rested, making a plan for the next day, like setting out your clothes the night before, things like that that are helpful for elementary school students to learn as they build up their school routine. The middle school toolkit again has affirmations that are more like celebrate progress, not perfection. There is also a self-care checklist to help students track mood, meals, and the ways that they connected with their friends and family that day. That's really helpful for them to kind of keep track of like, make sure that they're starting to build healthy habits in life as they become more independent. And then also remember to connect. Isolation and loneliness comes up a lot in our conversations in when we looked at school stress, but also when we look at adults. And so building that muscle early about how to connect with family and friends and remembering to do it. We have this really fun wellness challenge checklist that's really designed to help middle school students try out different kinds of wellness activities. So we have things like giving a compliment to somebody, but also things like trying a breathing exercise, trying a visualization technique, volunteering, or helping out a friend. So some of these different kinds of things that when we think about the ways that we cope maybe as adults by doing these things, helping middle school students really start to build that muscle. The visualization activities look like visualizing 5 of your hopes and dreams. We started to include more content in this about how to get a good night's rest and then also how to make a mental health plan for the days when students do feel stressed and need additional support. The high school tools kit is even more robust. So we have again that self-care checklist to continue to remind students to build those habits, or even if they didn't look at our toolkits last year and this is their first year in high school, kind of helping them see that. The wellness challenges again to help people really understand and build the different pillars of wellness within themselves. And that looks like volunteering with a new organization, making a healthy after school snack, things that are a little bit more age appropriate. The visualization technique activities are more like creating a vision board about your dream vacation. So way more in depth than thinking about 3 things that you like about yourself, which of course is helpful in this situation as well, but goes a little bit deeper. Here we also started to encourage some kinds of coping techniques like creating art and getting physically active. We included pro tips for studying for tests and finals, knowing that that's a big thing that comes up for high school students, especially as they are, preparing for college or whatever is next. Some tips for neurodivergent students, is that something that we see come up more often in our conversations. And then again, that mental health plan for the days that don't go the way we want them to. The college toolkit is also similar, where we're kind of encouraging more connection within the college community. Um, like starting a conversation with classmates you don't know very well, organizing a coffee outing. The visualization techniques again are more like creating your dream board for your dream vacation. The coping techniques really speak to something that somebody in their 18 to 24-year range would have access to, like playing with pets and meditation. And then we also started to include things like Adulting 101, so how to take care of your daily responsibilities, some basic financial tasks to think about, as we know that finances are a big stressor for folks of this age range. Time management tips, how to say no if you need to, how to block your time so that you can get everything done that you need to do. And then again, those tips for studying, those tips for neurodivergent students, and then the mental health plan. All right. Any questions on the toolkits, on back to school stress or school stress in general, or about crisis text line? Aaron, yes, we do have materials in Spanish. So those are all on our website. One of the things that I always like to talk about when it comes to crisis text line in Spanish is that we aim to be fully acculturated for when our Spanish services, so that means that we're never using like Google Translate to put things together. Our volunteers and our supervisors who are overseeing our Spanish conversations are bilingual themselves, and they also have gone through a specific training in helping people in Spanish speaking communities with mental health. So being really cognizant of things like how that shows up about immigration, how multi-generational family households are going to come up more often, how stigma shows up differently in Spanish speaking communities than in other communities. So we really try to train around all of that and keep all of that in mind in the resources that we put together that are Spanish facing. Um, are the volunteers trained to chat with people with special needs, for example, ASD? I will be honest that I'm not familiar with the acronym for ASD. I'm sure I know the word if you type out what that is. Um, our volunteers are generally trained in helping people who, oh, autism, thanks. So we do cover our volunteer training really covers like basic communication techniques so that we can have conversations with people who differ from us in a variety of ways. We don't specifically train on autism itself, but we do have some tip sheets around general neurodivergence and helping folks who reach out to us that do identify that way. Um, so we have some resources, but it's not something we specifically train on. I hope that helps. And when I mean identify, if they self-identify that way, we would never sort of like guess that that's what was going on. One thing that people always tend to ask me in these presentations is sort of about wait times. So if folks reach out during the day, they should get a anybody who texts us at any point in time should get an immediate response, at least with our automated messages. So if they don't get that automated response, something failed technologically and they should try again, or maybe try reaching out over WhatsApp or over chat, because we do know that sometimes, especially in areas with lower cell phone bandwidth, that sometimes there are just general, if they have issues texting anyone, they might have issues texting us. So that's one thing to know if you are talking with somebody who is like, I texted them, but I never got a response. There should always be the automated response. If they don't get that, then it's helpful to try another avenue for reaching out to us. And then when we are connecting texters with a volunteer, in the middle of the day, that usually is pretty instantaneous, less than a minute. If folks reach out to us overnight, when we tend to have less volunteers available, it can be a few minutes wait, like 5 to 10. But we are always doing whatever we can to bring that number down by recruiting more volunteers, having more people online, and things like that. Kenneth, you asked about if we use AI. So Crisis Text Line has always been a very tech-forward nonprofit, so we've used some forms of AI for a while. So like that machine learning algorithm that I mentioned that helps us triage our texter queue is one example of how we've leveraged technology to provide a great service. That being said, we don't use AI in our conversations with texters. They're always connecting with a real human. That is something we are pretty staunchly committed to. We are exploring ways to help volunteers be more effective in what they're doing, potentially using AI or other types of tech resources, but we are definitely not a bot. That is a big question that people always ask us. They're never connected with a bot. The only time that they're not talking to a human is those few automated messages, like I said, that help them let them know that they've connected. And then at the end of the conversation, after the volunteer closes it out, they will also get one more automated message that lets them know the conversation has ended and has that link to that post-conversation survey. But the rest of the things in the middle of those two questions in the middle of those two texts are by a human. Hope that helps, Kenneth. Yeah, Benjamin, that's a great question. So are you able to determine where the person is contacting you from? I wonder if there are trends or if there are trends with obtaining contacts from urban versus rural. So we don't always need to know where somebody is coming from. That really is only necessary in conversations where there might need to be a mandatory report or an emergency intervention. In those cases, what we're going to do is we'll be able to pull the volunteer will not do this. The supervisor, who is live on our staff and is a mental health professional and is trained, would be able to get the person's cell phone number and cell phone provider from our system. And in the case of an emergency, we would provide that information to an emergency public safety access point so that they would be able to use whatever processes they have available to determine location from there. In the case of a mandatory report, the person who we're texting with would have to give us their address and, of course, consent to that being happening. Um, so yeah, but when we think about like our data in general, because we do have this website called crisistrends.org where you can look at sort of um, that what's going on in states and in communities. We use the person's cell phone number again to just sort of generally understand where in the country, so we can like say, okay, this is probably somebody who's from Oklahoma. This is what's going on in that state. We find that that's accurate about 85% of the time for our texters. A lot of folks that we text with got cell phones where they still live. So in the instances where it's not an emergency, that's kind of just how we generally map out our service. Aaron, it's totally fine if they text school. Um, we I would say that for your community, it's always best to text Native or Indigenous to 741-741, um, so that we can make sure that the volunteers get the Native specific resource up for them. Um, but if they text school, that will be totally fine. They'll always be connected. And then all of our volunteers are well equipped to talk about school stress. Benjamin asks if there is an urgent situation such as at-risk situation, are the parents contacted? Um, that would be dependent on sort of the protocols that the public safety access point would have. So I know that that differs depending on what community you're in. We wouldn't reach out to anybody on our half. We're going to just make sort of that call to the public safety access point to ask for an emergency service intervention or a wellness check, and then the public safety access point would handle that from there. I hope that helps. Mac asks, what do you think we could suggest to help a college student who seems to be very isolated? So, um, speaking as myself as somebody who was an isolated college student and not somebody who has any clinical training because I don't. I have an MBA, I went to journalism school, so just caveat on caveat for that. I always encourage, first of all, that you do share crisis text line with students who are feeling isolated, especially because isolation is something that can um, quickly turn into something where somebody might be thinking about suicide. And if we can connect with them and help them feel a little less lonely, that would be helpful no matter if, even if they are thinking about suicide or not. Um, I always recommend that if you're working with somebody who you think might be at some risk for any sort of anything that's going on. I mean, if you're like talking with somebody who's really down about a breakup that they're going through, just be sure to say, "Hey, I know you're going through a rough time right now, and I really care about you. And I want to make sure that if I'm not available for you to reach out, that you do know you can reach out to Crisis Text Line. They help with this topic. They help with many topics. It's not just suicide, because that might be what you're thinking when I say that. Um, and if it would be helpful, I'd love to have like a conversation with them right now with you, so you can kind of see what's going on, so you know what to expect if you do reach out. And when people do that, um, it tends to really help that student like feel a little bit better about what might happen and see like, okay, this isn't gonna, this isn't a trick it's not actually sending messages to my parents. It's not going to, the police right away. So that might help. And then for somebody who's feeling really isolated, I would say also that, for the college in the college playbook, that wellness, challenge sheet would be really helpful to like help them see that there are maybe some things that they can do within their reach to kind of build a little bit more community, um, and identify people who are safe to reach out to when they're experiencing that. I hope that helps, Mac. Mary says, I often have students reach out to me who are experiencing school stress. A lot of students are non-traditional. My age range in my class is 18 to 73 of age. Is this text line appropriate for the non-traditional students? It absolutely is. Yeah, we like I said earlier, we help people younger than 13, older than 65, even though people are always like, I don't know, my grandma doesn't text. And I'm like, well, my grandma did, so. And also when we think about 73, I think that for some folks that's our parents, and my parents certainly text me. My 85-year-old grandparents text me. So, it may not be their preferred way to get support, but it definitely is something that we can help out with, because like I mentioned, we're really we're really trained on having empathetic conversations, actively listening, risk assessment, these sort of techniques that are going to be helpful in any topic and any age range that we're helping out with. That said, for older folks, if they have a hard time texting, and they prefer to use, the Siri text, if they like read their text messages out loud, that works perfect. But if they want to send us a voice note, that won't work. We also never like switch over to a phone call, so that would be another difference between us and 988. 741 doesn't do phone call. We only do text, WhatsApp, and web chat. So, if you have somebody that you're talking to who prefers to talk about what's going on over the phone or over voice notes, that's not something that we're able to accommodate. I hope that helps, Mary. And also, Mary, one thing to think about is like when you are, um, work like at the beginning of the school year, we have some professors that we've known, or we have folks on college campuses who put text whatever to 741 741. So Mary, if you're working with students of all identities, it would be helpful to maybe just put school, or you could put hello as our most generics, so that students know that they have that resource. And then also in your email signature, in case, if it sounds like you are a safe space for students on campus, which is really, really sweet. And also, you have to go to bed at some point, and you're a professor. It's not your job to help make sure everybody is okay, as much as I'm sure you want to. So, being able to share crisis text line as a, okay, I've got you some, but also I have to sleep. There are other resources. There's always somebody up at crisis text line. There's no worries there. Awesome. Anything else I can tell you all about? Appreciate you, Mary, and thanks, Laura, for the sweet emoji. I'm really grateful that you all took the time today to learn about this, because I think it's just helpful to talk about different ways that people can reach out for support, different topics that people can reach out about, and then also like remember how stressful school is, so that when you're talking with a student, maybe they're coming in for their sports physical or they are getting their annual exam, just to check in and see how they're doing. Just help people feel more connected and remember that we're here for students, and that even though high school is a point in time and we'll all get past it, that it is also a really stressful point in time. All school can be a really stressful point in time. So I really appreciate you all taking the time to learn about this today. We have this webinar. Please, please, please fill it out so we know how effective we were. And then also, if you want to stay in touch with Crisis Text Line, I'd be happy to add you to our email list. We send something out about once a month, with things that are going on. We just sent out something for Suicide Prevention Day last week. We'll have something coming up in a few weeks for World Mental Health Day. So just with helpful tips to keep in mind, and different kinds of resources to share out. So thank you so much. I'll turn it back over to Dr. Endiford or Jonah.
Just wanted to say thank you, Jana. Really appreciate it. Thank you to all our participants for joining, and I will hand it over to Jonah.
Thank you so much to our presenters, Ms. Jana French. Thank you so much for your time and presentation today.